I am Michael Munson, and I'm really glad to join you today. As some of you may be able to see, we have an ASL interpreter. So if you would like to make sure that you see one of those two people, you can always pin them, and they will be spotlighting themselves back and forth so that you all can see them, as well as hopefully the slide deck and me if you'd like to see me. But they're much more important than I am. So again, welcome. We are going to talk today about supporting trans mental health and uncovering some of the barriers and building solutions. One of the things that we always like to start with in Forge trainings is the reminder for all of us to take care of ourselves. So this is the same image that I use in basically every training that we do. It is just a reminder to take care of yourself. We'll talk about some things today that might be painful or difficult, nothing overtly intentionally traumatic, but this topic can be really difficult for some folks. So please feel free to know that you can come back and listen to the recording since it is being recorded, and do what you need to do today to take care of yourself. Our agenda for the day is really quite simple. We're going to talk a little bit about data, very little bit about data. We will look at some barriers to trans and non-binary folks accessing mental health services or mental health systems. We'll look at how providers can reduce some of those barriers or increase access to mental health services. We'll look at some resilience factors, so how trans communities and how trans people are resilient and empowering and all of those good things. And then we'll end with a few resources, not a whole lot. Just a quick snapshot of who Forge is for folks that might be new to us and to our webinar series. We are a 28-year-old national trans organization that is exclusively focused on working on anti-violence issues. For the most part, that means sexual assault, domestic violence or intimate partner violence, stalking, hate-motivated crimes, and other forms of trauma. We spend about 75% of our time, roughly, doing training and technical assistance, so webinars like this, and about 25% doing work directly with trans survivors and communities. And I will note up front, I oftentimes just use the word trans, and I do mean trans, non-binary, gender expansive, that whole big, beautiful blossom of all of us who are under that umbrella. We have two guiding principles that really hopefully run through all of the work that we do. The first one is to be trauma informed, and we care about that when we're working with trans survivors or trans clients. And we also care about that when we're working with you. So for those of you who are providers here, which is probably most of you, the goal is to not leave you traumatized and to present in a way that's trauma informed. We also try to be as empowerment-based as possible. And again, that is not just for working with trans community members, but also for working with you as providers. We want to make sure that we aren't telling you, hey, these are the things that you're not supposed to do. We want to tell you and share with you and think with you and create with you the things that empower you to work best with trans clients. And all of that is informed through a culturally responsive lens. We want to make sure that when we think about trauma-informed care, we're thinking about the communities and the cultures that we're working with. So it may look very different for Black trans women when we're working with Black trans women than it does for like an older white trans man, just to give two very different, different types of identities. Just a teeny bit about who I am. Again, I'm Michael Munson. I'm Forge's executive director. I'm our primary trainer, but being an executive director means that I get to do all the fun other things. So I enjoy being with you all today, and I enjoy doing the whole range of other work that gets to my plate. Just for visual access, I am a white appearing person with a little bit of a round face and a round body. I have brown and gray hair and beard. That's a little scruffy right now. Glasses, and I'm wearing a purplish kind of flowery shirt, and behind me is a black background. So let's get started. Just a couple of housekeeping bits. We're going to interact in a couple of ways today. One is through Zoom-based polls, which many of you are familiar with. So we'll have two polls that will pop up, and you'll just get to click the answer that best fits your response to that question. And then the second way that we're going to interact is through your cell phone. So if you have a cell phone and you can text, we're going to encourage you to participate in some word cloud creations and some list creations by using this app. So we'll share this again when we get to those slides, but we will jointly create some brainstorms as we move along today. I wanted to start out with one of my favorite quotes from one of my favorite people. So this quote is from Lynn Fraser, who used to be the past president of WPATH, the World Professional Association for Transgender Health. And she said, a long time ago, I think this was probably in the earlier 2000s, a reminder that no one's identity is a disorder. So even though folks who are trans technically may have a diagnostic code of gender dysphoria or anything else that's in the Diagnostic and Statistical Manual, trans people are not themselves a disorder. So an identity is not a disorder. So I hope that we can keep that in mind. And I know many of you already know that and believe that already. I also wanted to kind of frame our discussion by reminding us that being trans does not inherently make folks more likely to experience mental health challenges, but some of the things that are around trans people, our culture, our discrimination, the things that are going on in the world are oftentimes what causes increased levels of mental health distress and challenges with access to services or some of the barriers that folks have. So again, when we talk about things, and we're going to share some data that's going to show that trans people are experiencing more levels, higher levels of certain types of mental health challenges. And again, that doesn't mean that trans people are necessarily higher in those things because they're trans. So we're going to start out with a poll. And so Caleb, if you're able to launch that poll, and as I just mentioned Caleb's name, if any of you have any technical issues along the way, please feel free to reach out to Caleb in the chat and he will help you. So we're going to start with poll number 1, which is how many trans and non-binary clients have you worked with in the past 10 years? And Caleb, I'm not sure, I'm not seeing it, so I don't know if it's up or not. And let me see if I can launch it. So hopefully folks can see this poll that logged up. So how many trans and non-binary clients have you worked with in the last 10 years? This is presuming that you're a provider of some type, and feel free to not respond if you're not a provider. So the options just for folks to for access are none, 1 to 3 clients, 4 to 10 clients, or more than 11 clients. All right, we'll just give folks another couple seconds. And so it looks like the majority of you have worked with a fair number of trans clients, which is fantastic. So thank you for voting and sharing a little bit about what your experience has been in terms of volume of trans clients. And if anybody can't see my screen now, please let me know and I will do whatever needs to happen. So let's look a little bit at data. And again, we're going to just do a very brief review of some data related to mental health and trans folks. So when we look at things like depression and anxiety and post-traumatic stress, so some of those common mental health challenges, we know from multiple studies that trans folks are about 4 times more likely to experience those general mental health conditions. So that's substantial, right? So if we're working with clients, they're likely going to be coming in maybe more depressed, or at least at a higher level of prevalence. We know that individual communities may experience some very specific things like the severity or the prevalent or the amount of presence of that mental health challenge. I'm just going to share this one slide with you about a survey that we did in Wisconsin, and I think this is likely very applicable across the country. When we sampled folks, we had about 500 people in our sample across the state. 83% said that they had a mental health condition that impacted their daily life. So We've got 4 times as many trans folks that are feeling those symptoms of depression or anxiety or post-traumatic stress. And of those people, a lot of folks are really experiencing the daily impact of those mental health conditions. We can look at rates of substance use. So in general, if we look at the general US population, it's around 7% or so of folks that have challenges with substance use. Some people call it substance abuse. I tend to prefer to call it substance use because we know when people are dealing with trauma in particular, that people use substances as a way to cope. So I prefer to not call it abuse. But when we look at the rate of the general population versus the trans population, you can see on the slide that it's multiple times higher. So 26% of trans folks use substances versus that 7% of the general population. We can look at other types of drugs as well. So when we look at other drugs, they could be street drugs or non-prescribed drugs or prescribed medications. About 3 times higher for trans folks than non-trans folks who are using other substances, again, to help cope or to numb out or to do whatever it is that they need to do as to why they're using those drugs. We also know that a lot of trans folks are using multiple substances. This is certainly true for non-trans folks as well, but we're seeing that trans folks are more likely to use multiple substances at the same time than non-trans folks. We also know that a lot of trans folks are using nicotine higher than, about 3 times higher than the non-trans peers in their life. And part of the reason for all of these uses of substances or nicotine is to cope with what's going on in the world, in their life. And some of it is also where trans people have historically gathered. So if folks are meeting at bars, if folks are meeting at parties, some of those environments are more likely to have alcohol or drugs or nicotine present. If we shift to a slightly different subject, when we look at non-suicidal self-injury, so a lot of times people think of this as cutting or other forms of self-harm. And we can look at it as self-harm. We can also look at it as a coping strategy for folks who need to externalize the pain that they're feeling on the inside as a way to release some of the tension that might be felt. There's a lot of reasons why people engage in non-suicidal self-injury. A colleague of mine and a really amazing researcher, Lord Dickey, did his PhD dissertation on non-suicidal self-injury within the trans community. And what's on the slide right now is he looked at different types of gender identities, different kind of buckets, and looked at how many folks were engaging in non-suicidal self-injury. So at the point in time in 2015, genderqueer was a much more common word than it is today, only 7 years later. So that was the word that was used in this study. So the folks that identified as genderqueer, which would probably maybe identify as non-binary in today's more current language, were the highest level of those who experienced non-suicidal or engaged in non-suicidal self-injury. And you can see on the slide that other folks in other categories of gender identity also engaged in fairly substantially high rates of non-suicidal self-injury. Again, these are things that are not intended to end someone's life, but it's again, non-suicidal self-injury. When we do look at suicide, trans folks have an incredibly high rate of suicidal thought and suicidal attempts. So we know that at least 40% of trans folks have attempted suicide. So that is about 8 times higher than the general US population. When we look deeper into the trans community, we know that some subpopulations of trans folks may be experiencing or may be attempting suicide at even higher rates than that 40%. And let me share one example of that. When we look at the combination of trauma and trans folks, we can see that on this slide, I've selected 4 different additional areas. So we've got general US population, which is around 5% attempt suicide, trans folks kind of in general, who are at 40% who attempt suicide. When we add in factors like those who have been sexually assaulted, those who have experienced intimate partner violence, those who've been assaulted by a teacher, sexually assaulted or physically assaulted, that rate of suicide attempt jumps into the 60s and even 70% range. So there's a lot of things that we can think about with this. This is a really profound slide, and literally every time I see this slide and every time I talk about it, it takes my breath away to know that so many people are struggling so much that they want to end their life. This is also an opportunity for us to change some of the systems, because you can see that the highest number of suicide attempts are those who experienced violence by teachers or when they were young. So if we can transform some of those systems, we will be hopefully reducing that suicide risk. I'm going to give a little teaser. We're going to talk about ACE scores, which is the Adverse Childhood Experiences Study, in our next webinar in November. But just a little snippet of it, adverse childhood experiences, or ACEs, are things that have happened in childhood and result in negative or adverse outcomes in adulthood. So it could be negative health outcomes or negative mental health outcomes. So there's kind of like a scoring method of how many kind of bad things happen to a kid. Those are the adverse childhood experiences. And then what is their impact later in life? So when we look at the general population, about 60%, 58% of folks have experienced one ACE. And one ACE could be that their parent used alcohol or drugs, or their parent was not present because they were in jail, or they experienced physical abuse or neglect. Those are examples of ACEs. For trans folks, though, it's not 58%, but it's 91% have experienced one ACE or more. When we look at folks who've experienced 4 ACEs, so getting up the level of more and more things that have happened in childhood, general population is around 20%, and the trans community is at 61%. So a lot of childhood trauma is happening in trans people's lives. We're going to talk about that a lot more in November, so please come back and we'll go into much more detail about that. So a couple of comments about why people might seek therapy. I mean, we just talked about some of the rates of depression and what's going on in trans people's lives, but I want to remind us all that people might be seeking therapy for any reason. The reasons that non-trans people seek therapy for things like depression, anxiety, post-traumatic stress disorder, challenges coping with relationships, any of those things. And I'm mentioning this because a lot of times I think folks that are working with trans people think that those trans folks are coming to talk about their gender identity or their gender expression or something about their gender. And in reality, the majority of people are seeking care for those, I don't want to call them garden variety, but traditional types of depression and anxiety and trauma-related things. So again, this is just a sample of a survey that we did in Wisconsin, but it's very true across the country as well. So like in our survey in Wisconsin, 87% said that they were seeking mental health services for those depression types of conditions. And 30% were seeking care for gender-related issues. And a lot of that 30% was about seeking a letter so they could access hormones. We'll talk a little bit more about that later as well. So here's our first experiment, and Kayla put it in the chat already, and I'm going to launch our poll. So the first poll is, what do you think contributes to higher levels of mental health challenges for trans and non-binary survivors? So you should be able to, in a second, as soon as this launches, be able to start typing in some of your answers, and hopefully this will work. I've done this a couple times, and usually it works. So again, if you go to www.pollev.com/forge333 and you text if you text forge333 to 22333, the question again is, what do you think contributes to higher levels of mental health challenges for trans and non-binary survivors? And I'm wondering if folks could give some feedback about if you are seeing, excellent. So people are saying stigma, discrimination. What else might be contributing to higher levels of challenges in accessing care? Isolation. What else? And Caleb, if you want to pop into the chat. So it's what do you think contributes to higher levels of mental health challenges? Mistreatment, settings. What else? History. What other things might be contributing factors to why there might be some challenges for folks to seek services? And I'm going to share with you some answers. So this is a great start. So we've got mistreatment, history, discrimination, stigma, family, training, so probably lack of trainings or training deficits, excellent culture, income, and these are all moving around, so it's hard to see. Excellent. Those are great things. Thank you for working and figuring this out together. So let me share with you a couple of things that we know are contributing factors. So there are a lot of things that can contribute to this, and minority stress is one of them. And we could talk a lot about minority stress, but just the fact that trans folks are in the minority and experience day-to-day stress, so microaggressions, things that relate to people's trans identity walking through the world, or trans expression walking through the world, adds minority stress. And again, this is a whole nother webinar that we could talk about. There is, like some of you mentioned, widespread discrimination, which can affect lots of components of people's lives. There are high rates of trauma, like we talked about. Cost can be an area that could be difficult for folks to accessing care. We know some studies have shown also that rates of violence can be a contributing factor to mental health in general and accessing services in particular. We know that discrimination can be a factor. So can cissexism. And I use that word because it's from the study that this is from. So the centricity of non-trans people in how mental health is provided, and other barriers to healthcare. I want to remind folks too that when we look at some of these barriers, when we look at some of these rates of mental health challenges, we really have to look at it through an intersectional lens. So when we look at folks encompassing their race, their disability, their economic status, their age, their nationality, their immigration status, all of those kinds of things that make up who we are, each of those things may make it easier, but usually make it harder to access services, or might be increasing or decreasing people's likelihood of experiencing mental health challenges. So let's look at some barriers, and we're going to do this whole word cloud thing again, and hopefully I will do it maybe a little bit better this time so we can do it. So the question for this one, and let me launch the poll, is the question is, what are some things that may increase access to mental health services for trans and non-binary clients? Or what are some barriers to accessing mental health for trans clients? And so again, you can use that app. It's the same place, and hopefully things will start to pop up. So internalized transphobia, yes. Insurance, cost, funding. What other kinds of barriers are there? Lack of providers, exactly. Yep. May have insurance under a dead name or a former name. Cost, family culture, exactly. Stigma. Lots of stigma. Provider wait lists, exactly. That can be a really huge problem. Transportation, yes. Fear. What else can be barriers to trans folks trying to or wanting to try to access services? Let's give another couple of seconds to think about some more things. Past bad experiences, yes. Yes. Acceptance. Yeah. Yeah. That's great. That is a really great list. And Yeah, one more. So worry that they might have to teach the provider about trans terms, lack of family or friend support. Yes, all of those things. Excellent. Definitely all of those things. Let me share with you a couple of things, which are going to be repeats of what you just said, as well as maybe a couple of additional things. So let's look at some practical issues. So someone mentioned transportation, right? So there could be the cost of transportation, like people like literally cannot afford bus fare, or an Uber or something to get them, or gas to get them to their provider's office. They might have accessibility issues on public transportation. They could have discrimination in that transit process. So, a trans woman who's accessing, a bus to get to a provider's office might be harassed on the bus, by transphobic folks that are targeting her. There might be also access in terms of if a provider is not on a bus line or is out in a rural area and someone doesn't have a car. So there's literally no way to get to them if they don't have access to pay for a ride share or have somebody to give them a ride. Another practical issue is around the cost of care. So copays can be just too expensive for some folks, and that's presuming that somebody has insurance. So not everybody has insurance. And even if a provider offers sliding scale, a lot of times sliding scale doesn't go down to the level that trans people can afford. And again, when we look at things like non-urban living, so there can be really limited mental health services. And we're going to talk a little bit about that small community framework of why that's even harder in some of those rural communities as well. We can look at practical issues that are in community. So those of us who live and work in trans communities know that trans communities are small, they're tight knit. Everybody kind of knows everybody, even if you live in New York City or LA or a really large city. It feels like everybody knows everybody and everybody knows everybody's business as well. Even though that might not be really true, that's what it feels like to a lot of folks. So many folks don't want to ask their friends for mental health resources because of that stigma, but also because they're worried that, what's going to get circulated in their trans community. And then, of course, we do need to look at the fact that mental health conditions have stigma in and of themselves. And a lot of trans folks kind of want to do this kind of present as a good trans person and someone who doesn't have problems, because there's so much discrimination that a lot of times trans people feel the pressure to look and be in the world as healthy as possible. So again, there might be some, I don't want to disclose that I'm struggling with substance use or mental health issues because what other people will think. We can look next at access inequality. So we've talked a little bit about this. So health insurance is clearly one major access inequality or inequity. Not everybody has insurance. Not everybody has insurance that covers mental health. Not everybody has insurance that doesn't involve high deductibles or high copays. Because of the fact that trans people oftentimes experience employment discrimination, and there are not universal laws across our country that protect trans folks against employment discrimination. There's a couple, but trans folks are still getting discriminated against, not employed at the same levels as non-trans folks, might be working lower wage jobs or part-time jobs. Those jobs may not have insurance benefits, or they may be too unaffordable for people to access. We also know that trans folks are more likely than non-trans folks to be working in the street economy. And street economy is generally not going to come with insurance unless if it's a self-pay, self-bought insurance through the marketplace or through a private insurance company. And again, we can look at that access inequity with things like everyday discrimination. Like I mentioned, somebody getting on the bus, that could be a really big access challenge for folks because of the discrimination that they're going to experience getting from their apartment or their home to that provider's office. Someone mentioned that fear was a barrier. I mentioned that early on, and I want to really highlight that fear is something that seems to be incredibly pervasive and incredibly widespread. So a lot of trans folks are fearful of accessing care, talking about their mental health, worrying about what's going to happen at a provider's office. And we're going to break that down a little bit, but I really, really want to emphasize how much fear plays a role in folks getting mental health services, or even acknowledging to themselves or their friend circle that they're struggling with mental health challenges. So one of the other things that you all mentioned was negative experiences or negative past experiences with providers, or maybe a community member who has shared something with another trans person that said, hey, you know, I had this really bad experience going to this provider. They were supposed to be trans positive, but man, I really had a bad time. I know I just used a gendered word as well. We know that when folks go see providers, that not everybody's trans informed, and even the ones that are most trans informed sometimes can still re-victimize people, still cause trauma, in addition to trying to provide good and quality care. Those direct negative experiences can really, really, really impact somebody's willingness to try again. So sometimes one negative experience is so big and so powerful to someone that they're not going to try again, or not going to try again for a really, really long time. And that can make mental health symptoms get a lot worse. And it's harder to treat things when they get worse. We also know that providers can be overtly abusive or violent or hostile to trans people. Again, those usually are not the ones that are claiming to be trans positive or trans aware, but some providers really are those kinds of negative things. And I think we all have to be kind of prepared for that, or know that our colleagues may hold negative opinions or may act in inappropriate ways. I'd like to share with you a short video clip of a panel discussion that we did earlier this year in 2022. And this is a brief video that Travis Trott is speaking about some past negative experiences that folks have had. Travis is a therapist and has worked with a lot of trans clients. So let me share this video with you.
So if we go back to our predetermined questions, let's talk a little bit about prior barriers.
I'm guessing y'all can't
I think
hear
all
that.
of us know that many trans and non-binary people have experienced difficulty accessing trans affirming, trans knowledgeable, and trans celebratory services and providers. So what are your thoughts on that reality in general, or more specifically, how does a client's past experiences with service providers impact your working relationship with them in the present?
So I'm probably not the only therapist, right? But people do come in with really horrifying stories, right? I'm getting the nods, yes. Of the, this is what my last therapist said to me, or this is, I haven't been back to therapy because the last one said this. And it's a spectrum, right? Sometimes it's downright hostile and unwelcoming, and sometimes it's just clumsy and foolish, or I had a feeling when I wanted to talk about this that my therapist was uncomfortable, right? Like that they wanted to move away from it. So and yeah, but when somebody comes in with that story, you know, one of my first questions is, have you ever done therapy and how did it go? I guess that's two questions, but you know, is to say, you know, you have every right to be, well, A, to praise the person for even trying it again, right? Like you would have every reason to like protect yourself and not want to go through that again. But then also to say you have a right to be skeptical here, right? And check me out, right? Like don't take my word for it that I'm trans affirming. Really listen to yourself and check in with yourself, and I'll check in with you, and we'll see how it's going. Just, you know, because I tend to go strengths-based and empowerment-based. And so I want to make sure that that person really is like looking to themselves and not just to me as like some expert. So yeah, I think those barriers are still very real. It happens all the time today. You know, I think my job is like to help do some of that repair work, not to make up for what other therapists have done, but to say, you know, how do we heal from that? Or how do you do that really big, scary thing, which is to trust somebody again with your story and with yourself.
Thank you. So that, I think, is a great reminder to us all of just the incredible amount of trauma that folks have experienced through past interactions with therapists. And Travis, I think, is just he's an amazing therapist, and I think he's just beautiful in his language. But some of the work that therapists might need to do with trans clients is some of that reparative work, not in that traditional like negative reparative work, but like, helping people recover from negative experiences before folks can even work on the current issues that they're experiencing. So if we continue on this theme of looking at fear and what is happening around fear with folks, there can be a lot of fear around systems. And systems can be the whole gatekeeping thing, which we're going to talk a little bit more about too, specifically around gatekeeping. But anybody that's in a position of authority, and so a lot of times in our culture, we kind of have therapists are in kind of a higher level of authority than trans clients are. Organizations have authority over the therapists that work for them. So we can look at this kind of system of hierarchy that happens in places where people work, and how that then passes down to the trans clients who are accessing care. Systems like, hospitals or inpatient services, which so many trans folks do not want to access, but some of those inpatient programs may determine things like what gender you get to present as and who you get to room with in terms of gender. So there might be those systemic levels of changes or decisions that are outside of a trans person's control. Insurance companies may have trans exclusions. They're not supposed to, but many of them still do. There might be policies at agencies that might be around sex segregated services. So the policy is like, this is a support group for women only. And so that means that a lot of other folks don't fit that group. So trans men, non-binary folks, maybe even trans women. And we know that law enforcement is a huge barrier. And I bring that up here in terms of a systems issue, because a lot of times when people are having severe mental health crises, one of the first people that may interact with them is law enforcement, who may involuntarily take that person to a hospital or put them in a lockdown hold. So those are some of the systemic challenges that a lot of folks are fearful of, if not directly have experienced. We can also look at things like historical trauma. So I just mentioned institutionalization. There used to be a lot more of it than there is today, but folks are still being hospitalized against their will and because of their gender identity or gender expression. So that's a historical issue, but it continues to this day. There's historical issues around gatekeeping and pathologizing of, folks used to have to want to be heterosexual and want to be binary in their transness or in their identity in order to access services like hormones or surgery. We know that conversion therapy used to be more common, but it's still very, very prevalent. So that's another piece of historical trauma. We know that some religions and politics have really negatively impacted trans people's lives, again, historically and currently, and the level of police misconduct. So we could spend, again, hours talking about historical trauma, and it's still quite pervasive. So we're going to do poll number 2. And Caleb, do you want to launch that this time? And the poll question is, WPATH standards of care, so the World Professional Association of Trans Health standards of care, are the gold standard, and I adhere to them in my practice. So again, this is intended for providers. So answers are strongly agree, up to strongly disagree, or I don't know what those standards of care are. So again, the question is, WPATH standards of care are the gold standard, and I adhere to them in my practice. I'll give folks just another 30 seconds or so to answer. Great, thank you. So it looks like many of you don't know what the WPATH standards of care are, and in some way, I think that's a great thing, and we'll mention a little bit more about that as we go along today. Some of you disagree and some of you agree. And there's no right or wrong answer to this question, but we all have different relationships to different types of standards of care that we may or may not have to adhere to. And we'll talk a little bit about why we might need to know about the WPATH standards of care, and why and how they might do a little bit of harm for folks. So thank you again for participating. So let's look at things like provider knowledge. One of you mentioned before that a lot of times providers don't have a lot of knowledge, or they have a little teeny bit of knowledge. And one of the things that we oftentimes hear are providers who say, oh, I've seen a trans client before. I'm good. I've got it. Like, I don't need to get training because I've seen one trans client. We all hopefully know on this webinar that having one trans client is having one trans client. So it doesn't mean that you know a lot about trans folks or trans concerns or trans barriers or anything else. It means that you know one trans client. So we want to make sure that trans affirming therapists become more trans affirming and trans knowledgeable through trainings like this and like many others that are available. We also want to make sure that our trans clients are not in that role of educating providers. Not their job, that's not what they're paying you all to do. There might be a perception by providers that there are limited opportunities for training. And I want to remind folks that that's not really true anymore. We used to have, we have a growing number of training opportunities that are available for free. Some of them are at cost for CEUs, but that's another way that you can gain access to CEUs is doing trans-related trainings that do offer CEUs. So it's just a matter of looking for them. And I will remind folks that Forge has quite a few archived webinars online that you can access for free, access with your colleagues, but there are many across the country if you use your friend Google to look for them. There may be some lack of institutional support for accessing trainings. And so, this is another systemic issue where we want to make sure that we help organizations value getting providers trained. So all providers in their agency trained, support staff, everybody trained. Pathologizing folks is another one of those things that can really, really be challenging in terms of a barrier in accessing care. So when we talked about the WPATH standard a few minutes ago, we know that some providers are rigidly adhering to the WPATH standards. And the WPATH standards have loosened up a lot, but they used to be very restrictive and have time parameters, like for how much time people had to do therapy, that people had to do therapy if they wanted to get hormones. So I'm going to let you all read more about the WPATH standards of care, but that can be a really big barrier, and it can feel to trans folks like people are pathologizing them. One of the things that we know either with WPATH or just in general is that trans people feel pathologized when a therapist might be approaching or interacting with somebody or asking questions that are really not appropriate or that are curious in ways that are not serving the client's best needs and their best desires of why they're there. We also know that some providers end up diagnosing the clients that they work with who are trans, and they diagnose them either consensually or not with gender dysphoria or with something just because they know that that client is trans. That client might be there for reasons of depression, and that would be an appropriate diagnostic code. So we want to think about what we're doing with those diagnostic codes and asking our clients to make sure that that's okay and what they're really there for. We know that some providers really focus too much on transness. So again, not focusing on what that client really wants to work on in your office. And then sometimes clients are faced with the challenge of their provider presuming a causality or a correlation between their mental health symptoms and their transness. And they may or may not be related. But we want to be careful as providers to not make a causality or a correlation between mental health and transness. So we've mentioned gatekeeping. You all did, and I've mentioned it a couple of times. So providers are in a position of power, and insurance companies are in a position of power for those who have insurance. And providers can really control access or limit access to gender affirming care. And they can limit access to other mental health services. Providers may not want to refer folks to other providers or other support groups, and may really control what information is shared with that trans client that's in their office. They may try to dictate, again, what kinds of gender-specific services a trans client could access. So again, they may or may not recommend a women's support group if they're working with a non-binary femme-oriented person, because that therapist might not think that they would qualify, rather than giving that client the option of determining whether they fit into that group or not. Again, I mentioned this on the last slide about providers determining what diagnostic codes to use. This can really severely impact somebody's ability to use their insurance. So if there's an exclusion in someone's insurance policy that excludes trans-related care, if a mental health provider diagnoses someone with a trans-oriented diagnostic code, that insurance company could deny paying for all of that care. So that's a huge challenge for folks, and then that makes it be inaccessible for those clients. It can also pose a safety risk for clients. So again, if we look at who's out or not out at work, that can play a big role. When we look at therapists, we try to not think about things like power and control tactics. But again, therapists oftentimes kind of are in that higher level, and clients are sometimes below, even though we want to have an equal relationship. Therapists can do things like threaten to institutionalize folks. I know I already mentioned that, but I think that's a really big fear. And it is something that providers do have kind of the ability to do if certain symptoms are present. Providers can do things like threaten to report a person to Adult Protective Services. Some of you are watching the news. Texas was one of the states where the governor was trying to encourage people to call Child Protective Services if the parents were providing their children with appropriate hormone therapy or puberty blockers. So we know that providers can do things that call in other providers that may cause direct harm to trans people or their trans families. Providers can also threaten to withhold gender-affirming services or referrals. And sometimes power and control by providers looks like, hey, you won't ever find another therapist who will work with you. So like, you got to stick with me because I'm the only one who will deal with you kind of people. So those kinds of things may actually come out of providers' mouths. None of the folks that are here, but that can happen, and that can be some of the experiences that people have. There can be a lot of unintentional harm. So what I just talked about before was kind of more the intentional things that a provider can do to exert power, exert control, intend to cause harm. So some of these things are unintentional. So asking intrusive questions. And I bet if you asked 100 trans or non-binary folks, have you ever been asked about your genitals? I bet almost all 100 would say yes. So that's an example of an intrusive question. Or what's your real name? Or some of those kinds of things are incredibly intrusive, and they're very inappropriate. We wouldn't ask them of a lot of folks that we knew were not trans. Unintentional harm can be done through not using someone's name or pronouns, or not asking what someone's name or pronouns are, so they aren't able to offer that to you. It can be in misgendering someone, and that can go beyond pronouns and names. But how do people refer to you? What kinds of language are they using? What kinds of references or inferences? People also might be making assumptions about people's identity or experiences, and that could be about how somebody looks, about what experiences somebody reports has happened to them. And a provider might make an assumption about, oh, well, that happens to boys, or that happens to girls, or that doesn't happen to trans people. So those are the unintentional harms. That it's meant to be like, oh, I'm understanding you, I'm trying to understand you, but not really understanding. And there can be a presumption by providers of trans and non-binary folks wanting to transition. And probably all of us on this call know that a lot of trans folks or non-binary folks do not want to take any transition-related steps. So again, providers sometimes kind of follow the mainstream thinking, which is like, oh, trans people move from box A to box B, and that's not true for the majority of folks that are trans. So this is being mentioned after we're quite a bit in today, but our political climate really impacts both what's going on for the mental health of trans and non-binary folks, as well as how providers are providing services, how they're advertising their services, what kind of outreach they're doing. And again, the political climate leads back to fear. So like that slide that I had on fear before about how pervasive it is and widespread it is, we have a lot of fear that's in our culture right now. We know things like that there is an increase in the number of anti-trans laws or legislative efforts or policy changes that are happening. We know that there's kind of cultural pathologizing. So people in the culture, not in the medical or mental health community, are saying that trans people are sick or freaks or not human. So that's kind of this cultural messaging that's happening. We know that there's some increases in hate-motivated crimes against trans folks. And we know that's even more true when folks have marginalized identities, multiple marginalized identities. When folks are immigrants and trans, when folks are people of color and trans, when all of those things add up, there's increased levels of hate violence. And all of those things lead to really systemic fears and safety concerns. Many trans folks are really feeling concerned about leaving their homes or apartments, going to work, being out in the world because of what that climate is like, politically and socio or culturally. A couple more bits of data. When we look at what's happened with the increases in hate-motivated crimes, this statistic is from the FBI. And so I want to preface this with a lot of folks do not report their crimes. So a lot of folks are not getting into the FBI's data. So on this slide, it says 587% is the increase between hate violence in 2013 and 2019. So an increase of 587%. And this is just what the FBI is tracking. So just think about the profound nature of how much more hate violence there is for trans folks and for other marginalized identities. The good folks at the Trevor Project have noticed that those political changes, what's going on in our culture, have really impacted what is happening with the folks that are accessing their services. So when they looked at over 35,000 trans folks that are accessing their hotline, 94% of folks reported that politics had negatively impacted their mental health. So that's a huge number, right? It's almost everyone is feeling that their political structure around us is negatively impacting their mental health. More than half have seriously considered suicide or attempted it, kind of related to that political realm. What we know too is that current events have an overwhelming result of fear. So again, fear is this predominant thing that goes through all of these different types of things. So again, trans folks are feeling unsafe on the streets, leaving their house, getting on public transportation, being out in the world. A lot of concerns around employment security because of some of those things that are happening in our culture. Worries about housing security. And these are presuming that people have employment or housing. People are more and more concerned about accessing bathrooms. So schools are sometimes making more restrictive policies around bathroom access, but so is the world. There's more and more people are feeling kind of a sense of righteousness or the willingness to say to trans people, you don't belong in this bathroom, or even exerting some forms of aggression or violence. People might be concerned and experiencing real life challenges in their relationships. In particular, I'm thinking about things like their family relationships. So, if they go home for the holidays, have their parents or their siblings started to talk about who they follow politically or what their political beliefs are? Because more and more folks are talking about their political beliefs. So if that trans person is there and has really radically different political beliefs, or might not be out to their family yet, what is the tension that that's going to create in that family structure? That trans person may not want to go home for the holidays, and that loses out potentially on some of their support network. And again, I've mentioned hate motivated crime. So that's another, just one of those things that people are fearful of, and that's actually happening. We know too that people are engaging in coping strategies that are tried and true, that have been around for a long time. But some of what we're seeing more of in these last several years, probably the last 5 or so years, is more and more folks are using alcohol and drugs. Some of this started to increase with COVID, when people were home more and they had more access to alcohol and drugs, and it was harder because people were isolated. But now we're seeing that people are isolating not because of COVID, but because the world is so hard and people are afraid to be out in the world. People are afraid of what's going to happen around their safety. So people are isolating. They're not calling their friends. They're not going out and being social. They're not accessing services. We're seeing a lot of hierarchies of oppression and some horizontal hostility within trans communities. So people saying, I have it worse than you do, or I experienced this and you haven't experienced this. And rather than supporting each other within the community, we're seeing people lash out at each other. And again, that's a trauma response. That's a response that's normal because folks don't have the skills of knowing how to better interact with each other. So again, that's something that we can help folks work on, is how to not be so horizontally hostile and create hierarchies of oppression. We know too that people are choosing to detransition. There is absolutely nothing wrong with detransition or retransition. Those things are totally, totally fine. I want to be really, really, really clear about that. But when people are detransitioning or retransitioning out of fear, that can be cause for concern. So we're seeing a lot of trans women in particular transitioning back to living outwardly as male, presenting as male. Doesn't mean that they're not trans, doesn't mean that they're not a trans woman, but they feel safer living in their sex assigned at birth. And so possibly not being seen or perceived or read as trans more, as frequently. The other thing that we're seeing a lot of is the increase in trans folks buying or accessing weapons. And we've seen this across the country in the last many years, where more and more and more people are buying or having guns or weapons in their house and in their possession. What we're seeing with trans folks is kind of the attitude of, hey, cops are not going to protect me. I don't have a therapist who's going to protect me. The system doesn't protect me. I don't feel safe at home. I don't feel safe on the streets. I'm going to protect myself. That's everybody's right to have a weapon and to feel those things. But what we do know is when folks are struggling with depression, especially suicidal depression, when folks are in violent relationships, having a weapon around dramatically in likelihood that one of those people, if not multiple people, will die. Let's look at some things that we can do. So we're going to take a breath if you need to. Those were really heavy things. So please feel free to stretch, move your arms, move your body around a little bit. And let's talk about some things that you can do, that we can all do to reduce barriers. So we're going to do another one of these word clouds, and let me launch the cloud for us. Oops. Yeah, just a second. And so this is question number 3, which is, the question is, what are some things that may increase access to mental health services for trans and non-binary clients? So the same routine, you can type with your phone, text with your phone, and the answers will start to populate hopefully in a second. So what are some things that can increase access to mental health services? Health provider training. What else can be done to increase access, to make things better for trans clients? And some of these might be words that go together. Having a directory, an out list, having training. What are some other things that would make things better? Increase access to care. I'm just seeing things move around without any new additions. So licensing boards, universal training, stress. There's probably something that goes with the stress. Those are great things. What else? Let's give it another couple of seconds for y'all to add more. Yeah, if someone wants to add what is out care or out list, that would be great. So these are great things that are on the list. Let me stop sharing this and let me share a couple of ideas of how folks can increase their increase trans folks' access to services and to care. One of the things is to be trauma informed, and we started out talking about trauma informed care. And this is something that we're not going to go into a lot today, but because of the high levels of trauma that trans folks face, it's really critically important that all mental health providers are trauma informed and in a culturally responsive way. So again, trauma informed is not a one size fits all model. And it's really 100% essential that we have some level of trauma informed knowledge when we're working with trans clients and ideally with any client. So training was mentioned. So training is like this go-to, and it's often a word that I don't want to use because, I mean, it seems like a catchphrase. Oh, we should all get training. And yes, we should all get training. Training is not a one and done. Just because we've gone to one training, it doesn't mean that we're done learning. So I encourage folks to find access to trainings that interest you. There's a lot of trainings now on trans and mental health and specific other things like an autism and disability and lots of things where those intersections are at play. So encourage folks to continue learning more and to stay current. Things change all the time. I can't keep up, and this is my full-time job. So, I mean, I encourage folks to stay as current as you can. Follow folks or organizations online, on social media, find out what's going on and what's changed and what's new. Another thing of making things better is around language. And again, most of us here know these things of like, we want to use people's names of use. We want to use the pronouns that they use. We want to reflect the language that they use, whatever that kind of language is. So we want to just make sure that we are respectful. We ask if we don't know something. All of those kinds of things will make it more accessible for folks. Paperwork is another thing that so many of us are really aware of. We want to create space for many genders. And that can be as simple as adding things like, what are your pronouns on an intake form? Or what is the name that you would like me to use on an intake form? Those are just, two little examples of where gender can be added to that space. We want to think about billing and diagnostic codes and charting. We talked a little bit about diagnostic codes before, but in terms of billing, diagnostic codes, and charting, these are things that we might not normally talk to our clients about. When we work with non-trans clients, sometimes these things are just not even thought about in terms of a conversation. But these things can dramatically impact trans people's lives. Again, if a diagnostic code of gender dysphoria gets sent into somebody's insurance company, that may deny that person any kind of mental health care with you going forward if it's disallowed. There can be some safety implications. For example, if something is charted and you mention their trans identity in that charting, and that charting gets sent over to their primary care physician or possibly to an HR department, not likely. Some of those things may cause some safety concerns. So I really encourage folks to have that conversation with your client. Ask them what they would prefer. And obviously you need to work within your ethical bounds, but there are lots of creative ways to bill, diagnose, and chart in ways that are affirming to trans clients and do the job that you need to do. it's really important for us to kind of separate the X's from the Y's. And this again should be obvious, but it's one of those things where a lot of times when folks work with trans people, they are not able to separate out things like what's transness and what's mental illness, what's a mental health condition. They kind of get all commingled for the provider. And for a lot of trans folks, they are totally separate. Like depression is totally different than somebody's gender identity, and their gender identity is not causing them any distress. So we want to be mindful of like listening about if the person that's talking about their depression, if they're talking about it in a way that's about their gender, or if it's totally not related. We also want to think about things like the differences between body dysphoria and gender dysphoria. Again, how are we interacting with our client? Are we assuming that everybody who's trans has gender dysphoria? That's not true. That's not true for everyone. People might have body dysphoria, but not gender dysphoria, or the other way around. And we want to think about kind of really honoring those holistic approaches and the whole person. And one of the examples I oftentimes think about with this is some trans folks talk about their history in different gendered ways. So for example, someone who's a trans man now may talk about their history and they may use she, her pronouns in referring to themselves. They may talk about themselves as their parents' daughter. And that another person that's a trans man may always refer to their past in terms of masculine pronouns or as their parent's son, even if that's not exactly how they were raised. So we want to like honor that whole person and reflect back, you know, how they're talking about their childhood, how they're talking about their past, how they integrate who they are into their wholeness right now. The other things that we can do are to be really aware of our referral networks and how we do outreach or how we outreach to trans clients. So if we have a referral list, have we vetted our referral list? Do we know who's on our referral list? Do we know that they're trans aware or not? Do we network with trans organizations in our city or state or community? They're oftentimes the ones that are going to know best who those providers are who are trans informed. So network with them, connect with them, share your resources, get to know each other. And then what do we do as providers that sends the message to trans communities that say, hey, I welcome you in my office. I've been trained. I'm continuing to grow and learn about trans issues. You are welcome in my space. And that might mean taking out ads in trans or queer publications. It might mean showing up at Pride. But how do you get that message across to trans folks that you are a good, solid provider that is trustable? All right, let's look at a couple of practicalities again. So this is about accessing care. Mentioned a little bit before about cost is a huge barrier. So can you offer a sliding scale or affordable rates? Or can you offer some services pro bono? Can you work with an agency that gets grant funding that allows you to provide free therapy to folks at that clinic? Lots of things to think about with that, but a lot of times cost is a huge barrier. We also talked about transportation before and what that means to be accessible. So that's literally about is it on a bus line, or is somebody feeling safe enough to take a bus or public transportation? We also want to think about, is the building or the location that we're at accessible? We also want to think about telehealth. So if we're doing telehealth, does somebody have a phone that has, you know, high enough broadband or access or cell signal that they can connect to you by telehealth? If you're in a brick and mortar building, is that building literally ADA accessible? Does it have stairs? Are there accessible bathrooms? So those kinds of practicalities we want to think about as well. We want to think outside of the box. We want to think about if you as a provider are willing to do things that you may not be doing for some other clients that are not trans. So in our world right now, a lot of insurance companies, a lot of physicians are requiring folks to have letters that say, you know, this person's been seen by a therapist and I think they're appropriate for hormones or surgery. That's a level of gatekeeping that a lot of therapists don't want to be doing because they don't pathologize trans people. but other systems may require that letter from a therapist. So think about if you're willing to do that for your trans clients, if you're willing to say that to your trans clients up front, and what that looks like for them. There are lots of resources to figure out how you can do that. Forge is happy to help you. If you don't know, well, how do I write one of those letters? We are happy to help you with some sample letters that you can use with your clients. You may also be asked to take the role of, supporting a client in coming out at work or coming out at school. And again, that may mean talking to people that you normally wouldn't be talking to. And again, this is not going to be something that every therapist feels comfortable with, but this might be a primary need for trans folks when they're seeking care specific to their gender identity. We mentioned the WPATH standards of care before, and I briefly mentioned informed consent models. We know that a lot of insurance companies, again, for those folks that have insurance, require and kind of use the WPATH standards of care as their litmus test, as a way for clients to access trans-related or trans-affirming services. So some of the challenges that therapists may have in working with clients is, how do you maintain an affirming, non-pathologizing relationship with your client and recognize that that client may need those gatekeeping letters or procedures or diagnostic codes in order to access those things. So that might be part of the therapy work, is trying to help affirm that client, knowing that they have to work through systems that are not very fair and not very comfortable. Wanted to mention a little bit about crisis and harm reduction. So again, this is, how do we make things more accessible to folks? If at all possible, it is really, really critical to think about what some alternatives are to 911. What are some of the harm reduction approaches? And I know that basically every therapist and probably all of you on today's call are mandatory reporters. And that may mean that you feel the need to report if somebody is feeling suicidal or homicidal. And we obviously want people to be safe. I think that that's true for any therapist, is wanting their clients to be safe. And we know that for a lot of trans folks of color, a lot of youth, pick many other marginalized identities, having 911 called can increase somebody's level of harm, increase their depression, increase their suicidality, cause more problems than it does good. So a couple of ways, and many of you already have good working strategies, is to talk with your clients, maybe at some of those first sessions, reminding them that you're a mandatory reporter, reminding them of ways that you can dialogue so that you can do what you need to do and your client can stay safe. You can also make agreements with your clients. I'm not going to go into the ways that you may want to work with your clients, but there are ways to really reduce the level of harm that people are feeling and experiencing, and not increasing it by using 911. Just another example of this is that a lot of times the suicide hotlines that people call will call 911, will call authorities, authorities in big quotes, when someone is saying that they're suicidal. Oftentimes they won't, but they can. So again, knowing who does or doesn't, because there's a couple of options that don't call 911. Those may be the options that you may want to have on your crisis line referral list. One of the last pieces is really looking at how can we all work for justice? Again, this might be out of your scope as a provider, but how can you show up? Can you show up at rallies? Can you sign letters that advocate for trans-affirming policies and laws? Can you show up by voting? How can you take action in whatever ways feel comfortable for you within your licensing structure, all of those things that you need to be aware of, but how can you show up in ways that make life better for trans people, which will in theory reduce their mental health distress? I want to share this video. Again, it's from the same panel that I shared with you before. One of the folks is actually on this call too, which is great. And the person that's speaking is Kim Skirvin, and she is addressing what therapists can do when they might know more about what's going on in the current world than possibly other folks in her that are around her.
You know, a couple of things that you all said, and this is going to be a toss in the ball new question, is it reminds me of what our political climate is right now, and how both in Wisconsin and in Texas and all across the country, there are a lot of things that are really harming trans folks in terms of accessing medical care, conversion therapy things coming back up. And I'm wondering if you could talk a little bit about how is that impacting the clients that you see, your approach to working with things? Has it shifted you in your practice at all, knowing what's going on, you know, either in your personal community here or across the country?
I can hop in. I don't know if I'm talking over anyone. I apologize if I am. But yeah, definitely coming up. And I think one of the things that it is making me be aware of is making sure that my colleagues are aware of what's going on out there, because I think a lot of times, I mean, obviously I follow this stuff really closely and I know like what's happening. Um, but a lot of people don't. And so I guess it kind of gets back to this, like, what do I see as being my job aside from doing therapy? And one of the things I think is part of my job is educating, working on advocacy, but like making sure that my colleagues know about what's happening, because things are going to come up in session, and if you're not really aware of the context of what's going on, then the likelihood is that you're going to miss something, and you probably will miss something anyway. But so I think that that's one thing I've been aware of lately. Yeah.
Great. So that's one of the things that y'all can do, is to be mindful and be aware.
You know, a
And
couple of things that,
sorry about that, and pull that forward. I'm very aware that we've got about 10 minutes left, and we're running a little teeny bit behind. So I will do my best to make sure that we can clock out at 1:30. So let's talk a little bit about resilience. And there's going to be a nice swear word on the next slide, but it's really worth saying. So Miss Major, who is one of our elders, wonderful kick-ass people in the world, one of her taglines is, "I'm still fucking here." And one of the things about resilience and trans folks is that we are still fucking here. So just a reminder to all of us that, you know, trans folks deal with a lot of tough stuff every day and continue to be here. A lot of things that trans folks are doing is creating mutual aid structures of self-help and friendship networks and community and resource building, and creating support groups that didn't exist before, creating internet resources that didn't exist before. And trans folks are also starting to break some stigma. And I want to share with you a very, very brief snippet from a film that came out a long time ago called Diagnosing Difference. And this is Dylan Schlowinski, who is an author, an activist, and a radical artist. He's just fantastic. And so this is a little bit about stigma and mental health.
It's become so important for us, you know, as a movement, like people feel like we need to project this, like we're healthy, we're just like everybody else, like we, you know, but if we are in fact just like everybody else, then we are disabled, we are in wheelchairs, we have cancer, and we are mentally ill. You know, we do suffer from depression, we do suffer from schizophrenia, we do suffer from, you know, bipolar disorders. But historically, because we've been labeled as mentally ill, there's just this movement to deny that we have any mental illness at all. Like we can't be crazy, like, because that would mean that our being gay is crazy, you know, and so we internalize that. That's one of the reasons why I think we don't access care properly, or other people don't treat us properly. You know, I am crazy, and it's something that I've learned to celebrate about myself rather than, you know, give in to the stigma that the world assigns to me as a crazy person. That I find it to be something that I value about myself. I value how sensitive it makes me to the world, how much it makes me care. You know, like that's not something to be ashamed of.
So I encourage folks, if you'd like to hear more of Dylan's story, to either check out Diagnosing Difference, the film, or his book, The Last Time I Wore a Dress. So one of the other pieces of resilience is the in-community support and protection. So I've shared a little bit about this before, about how the community can protect each other from providers who may not be so trans-informed or trans-aware. So we can kind of share who's good and who's not so good. We can also engage in those harm reduction strategies of alternatives to calling 911 or crisis services. We can offer to be with someone and care for them and with them, rather than having them go to a place that's scary or possibly more harmful. We've got a lot of in-community empowerment that's happening. More and more trans community members are becoming certified peer counselors, which is fantastic. It's empowering people to really take action and provide those support services within the community. We also know that more folks are doing things like taking mental health first aid. Forge just offered 2 courses. And again, it's empowering folks to kind of look after and take care of each other. And more folks are getting certified in things like carrying Narcan, which can help for folks who may be overdosing from opioids. We're also seeing more and more positive messages in the mainstream press. So I don't know if folks watch the news, but if you watch the news, which is incredibly depressing most of the time, we're also seeing that a lot of the people that are sharing and presenting the news, at least on most channels, are able to say the word trans now, whereas that didn't used to be true, and are more able to talk about what's going on for trans people. So I wanted to share this really brief video. This is of Ali Velshi, and this was done a couple of years ago, and he's gotten better at how he talks about trans folks. You all will hear a little blip in this, but he's working it and he's got it.
Imagine having to defend yourself every single day, having to convince just about every person you meet that you are the gender that you say you are. Transphobic language is not funny. A person's identity is not the butt of a joke. To those of us privileged with a platform and a voice, it is not too much to ask that we do better with transgender and non-conforming people. It's basic human decency to do so. Remember that sticks and stones may break your bones, but words can do real damage.
So quick and easy. It was a spot that ran on MSNBC quite a bit between segments of their shows. Another thing that's really showing a lot of resilience in our communities are open and affirming churches, synagogues, places of worship. More and more places have trans pastors or ministers. We're seeing just more and more faith communities create spaces of welcome, create spaces of support, offer spaces for trans folks to meet, create and organize mutual aid. Lots of things are happening in those faith communities. We are also seeing a lot of intersectional alliances. We know that we're stronger together when we work across our marginalized identities. So the Women's March in 2016, 2017 was really kind of a kickoff of different groups with different needs starting to work together and realizing that we can make more difference when we work together versus working in silos. We are also seeing that more and more families are embracing and loving and caring on their trans and gender expansive kids. We don't live in a world anymore where parents are as skittish or as shy or as negative about their trans kids. And these young folks, they are doing a great job in saying, I am here and this is who I am, and you need to accept me. So this combination of young folks and the parents are just incredible. I want to take a moment. I am aware that it's 4 minutes before the end of the hour. I'm aware that some folks may need to leave. We have probably about 10 more minutes to go. I would like to keep on going, and I know that many of you might need to leave. We are recording. It will be there later. If you have comments or questions or things that you'd like dialogue about, Caleb's going to put the evaluation in the chat, and please reach out to us afterwards if you would like to have more dialogue. Okay, that was my pause. So because it's October, I want to share with you this video. It's a parent video, it's a kid video, and again, all about resilience and what has happened in our world that's a little bit different than it was 10 years ago, for example.
Good job.
Oh, hey, what do you got there? Pumpkins. Cool. You want to carve them? Yeah. All right.
Ew.
What is all?
Seeds are sticking to me.
Good. There we go.
All right, first one change gets an extra piece of candy.
I know. I'm gonna beat you. No. I heard it.
Get it.
Wait to try it on. Me too. Come on. Almost there. Yes, I did it.
Their costumes are gonna look awesome.
Oh my gosh, I can't wait. The haunted houses. I know. Trick or treat.
Wow, look at you two. You look great.
Thank you.
Thank you for keeping our streets safe.
You're welcome.
Get him.
Now we get to eat the candy.
Yeah, we do. Candy. My heroes.
Okay, I wasn't gonna cry, but you know, sometimes that happens. A few resources. Sorry, I've watched that video a zillion times, and yeah, sometimes yeah, very touching video, I think. Okay, a few resources for folks, and hopefully I won't start coughing with my crying. So I've mentioned a couple of standards of care as we've moved along. So I encourage folks who are not aware of different standards of care to look into ICATH, which is Informed Consent to Access Trans Health. It's one of the more kind of preferred models of less pathology. The other model that's really accessible and humanizing and really detailed in terms of language and access and guidelines for folks is out of UCSF, the University of California, San Francisco, called the Center of Excellence for Transgender Health. And it's really an ideal standard, and it's very affirming. And it does give providers a lot of really good places to go, and some examples of how to use language in terms of supporting their trans clients. And the older model that continues to get upgraded, and a lot of insurance companies still kind of require that folks use, is the WPATH standards of care. It has gotten a lot better over the years, but it's still the most restrictive and probably the least preferred by trans community members. A couple of other resources this is a guide that Forge created about 5 or 6 years ago. It's intended for trans consumers, but it reminds trans consumers of their rights and what they can expect, and to not settle for subpar care. And it goes into lots of detail that a lot of folks don't know about. So I encourage you to refer that to your trans clients if that might be useful to them. I played a couple of clips today from one of the therapist panels that we did earlier this year. There are 2 different therapist panels that we conducted in the spring, and both of them have really very different content with the same set of questions asked to each of the people. So I encourage you to check them out. They are on our YouTube channel and on our website. The other archived webinar that I'd like to share with you was a really fantastic webinar that Jess Stolman-Rainey did for Forge that was called the Liberatory Responses to Suicide and Crisis. It is definitely worth the watch. It's an hour and a half. Fantastic. Briefly, the next webinars in this series. So this was 1 of 4. Next one is in November on trans-specific ACEs. Next one after that is in January on state-sanctioned hate, which we talked a little bit about today. And then in February, we're going to talk more about informed consent models and moving away from those more rigid standards of care. You can find us online at our main website, which is forge-forward.org. Many trans folks who are survivors of violence appreciate the blog that we've got set up called transsurvivors.com, trans-survivors.com. And we welcome you to find us on social media. We're on Facebook and Twitter and Instagram and YouTube. So those are places that you would see new products come out and new information come out. You can also find me if you'd like to email me directly at mmunson@forge-forward.org. And that is what I have for you. And I'm sorry that I am 3 minutes over. I am more than happy to stay longer and to address any comments or questions that folks have. But I know that some people may leave. And I really want to thank you for being here and staying with us for the whole time. So thank you. And I will totally stay here if folks have questions. And let me grab one of the ones from the Q&A, which is not a question. Any other questions that folks have other than let's go and find other things to do? Thank you so much, everybody, for being here. And thanks to our ASL folks who are new to us and fantastic. So thank you all.